the ankle in with your elbow and as close to the bed as you can be, so you don't want to be putting the hip into too much abduction. Going to straighten the knee. What do you test in 0 degrees? If I'm pushing that way, what am I testing?
The LCL.
Nope.
MCL, PCL?
Just MCL.
Oh.
Yeah, so if I'm pushing that way, yeah.
Oh, that's
like
right,
from the back,
terrible.
yeah. So if I'm pushing that way, what's the difference between 0 and 30?
The different bands.
So at 0, you've got more capsule. So your MCL has 3 layers, so you've got 2 deep layers that attach into the capsule. If they're most painful at 0, that means that they've torn some of their capsule, maybe meniscus as well. If they're more painful at 30, it's just their superficial MCL. So really good to do it in both positions, because usually if their knee was bent when they got landed on, they will be more painful at 30. You don't have to worry too much about meniscus or intra-articular swelling. If they're painful here, you'd probably want to check their ACL as well. Well, you'd always check ACL, but you really want to clear their ACL and meniscus, because it's going to be a lot longer injury if they're painful at 0. So, locking in with your elbow so that the leg doesn't rotate. If you're holding it like this, it's really hard to control. So it's much easier if you just clamp there and relax. Yep, so I can do everything from here. Then, this hand, you're just going to palpate the joint line and a bit of support under the knee. The outside hand is going to go just pretty much at the level of the joint. So all the pushing is coming with this hand and my elbow at the same time. So I'm doing that movement. So if you watch the knee, can you see that joint suction there? That sulcus. So that's the joint movement. So it shouldn't be a real stretch, you're just seeing how much gapping you're getting. So that's how gentle it is. So in somebody that it doesn't stop, so it gets to there and it keeps going, you're so delicate that you can feel it just keep going. Whereas if it's just a big stretch, they'll recoil before you get to the end range. So that's what you're looking for, and you'll see that sulcus there. Then bend it up a little bit, exactly the same thing. And because you've got the pressure here, they're not rotating. Whereas if you try and do it like that, they just rotate and you don't get as good a result.